Today we'll discuss a very important case, acute glomerulonephritis. So basically what is acute glomerulonephritis is basically the inflammation that occurs in our glomerulus, which is the part of our kidney. So this is the kidney, and in the kidney there is structure, and this structure is known as the glomerulus, and whenever there is an inflammation occurs in the glomerulus, it is called as the acute glomerulonephritis. So we'll discuss the acute glomerulonephritis. So if an examiner asks what is the diagnosis in exam, then we will elaborate like this. We will say that it is a case of acute glomerulonephritis, and which is probably due to post streptococcal infection. So it is mostly seen after the infection by a bacteria which is known as streptococcus bacteria. So we will say it is a case of acute glomerulonephritis which is probably due to post streptococcal infection. So what happens, there is a infection caused by this bacteria, that is streptococcus, which first infects our tonsils or pharynx or tonsils being infected by this streptococcus, and after that, after a period of say 1 to 3 week period, after which it involve our kidney to cause the acute glomerulonephritis. So initially there is infection, and the patient presents with sore throat, and when this infection resolves after a period of 1 to 3 week, there occurs the in involvement of the kidney, and it is known as the acute glomerulonephritis, and this is the latent period, and this is known as the latent period. So latent period is, I will use some other color. So the latent period is 1 to 3 weeks if it is involving the pharynx, but if it is the infection by this bacteria can also involve the skin, and in the skin it can cause scabies, impetigo, like this. It can cause scabies, impetigo. It can also cause furunculosis, and here the latent period is 2 to 6 weeks. After 2 to 6 weeks the kidney is involved when the infection first occurs in the skin. So this is briefly discussing about the acute glomerulonephritis. So you will say diagnosis to the examiner like this, like it is a case of acute glomerulonephritis which is probably due to streptococcal infection. Now after this, the examiner can ask, why do you say it is a case of acute glomerulonephritis? Then what will you say? Then you will say, you will try to elaborate history to the examiner. So you will say the history. So what will be the history in case it is a case of acute glomerulonephritis? So now we will elaborate the history. History, usually the patient will be young, say 12-year boy or girl will be, it usually infects the younger individual. So young patient present to us with swelling of the face. There will be swelling of the face. So there will be swelling of the face, and the urine will be scanty. There is decreased urine output, or sometimes there will be blood in the urine called hematuria. So there will be swelling of the face, and the urine will be scanty, and hematuria will be there. Also there is passage of protein in the urine, and that's why sometimes the patients say they have smoky urine. So this will be the history, like swelling of the face, scanty urine, hematuria, or smoky urine will be there. And if there is a preceding infection before it involves the kidney, there may be history before 2 to 3 weeks back. There may be history of sore throat, or there may be history of scabies. So for sore throat, patient says that they have pain in the throat few weeks back. There will be pain in the throat few weeks back. For scabies, there will be lesions over the fingers in the web spaces. Scabies usually affect the web spaces of the fingers, or sometimes they involve the elbow, and these lesions can also be seen on the just below the nipples. Just below the nipples the lesion can be seen, and also around the umbilicus. It can be seen around the umbilicus, and also in the groin area these lesions of scabies can be seen. So there will be preceding history of scabies, and these are the sites where scabies can be lesions can be seen. And they also have itching all over the body if skin is involved in a case of scabies. So there may be history of sore throat, there may be history of scabies. Then we have to rule out other infections that can involve the kidney, like hepatitis B, hepatitis C, chickenpox, measles, mumps, viral infection. Even drug history is also very important. Drugs like steroid can also cause swelling of the face, and there may be periorbital puffiness. And also very important thing is patient diabetic history is important, and hypertension history is important in such cases because they have the involvement of the kidney. So we have to rule out these. So our case has a history of, in our case, there is a 12-year boy which present with the swelling of the face, scanty urine, smoky urine, and this is the history. And if we sometimes the mother will give the history, mother will say that as in the morning the mother could see the periorbital puffiness. So these are the eyes, around the eyes there will be swelling. This is periorbital puffiness. So mother will say that when his son get up early in the morning, there is periorbital puffiness. Why early in the morning? Because in the night when the boy sleeps, so this tissue is very loose, this eyelid, this upper and lower eyelid, the tissue is very loose, and when it sleeps the all the fluid gets collected in these eyelids, and when he gets up early in the morning, there will be periorbital puffiness. And we can also see the along with the periorbital puffiness, this is the area between the upper eyelid and the lower eyelid. This is the area, it becomes very narrowed, it narrowed down because of the fluid, and it becomes like this is narrowing of the palpebral fissure. There will be narrowing of the palpebral fissure. So you have to note this. So this will be the history, and we have to rule out other conditions like hepatitis B, C, history of diabetes, hypertension, and the history of drug history we have to rule out. Then what will be the examination finding in a case of acute glomerulonephritis? Now we will see what are the examination finding. Now in the examination we can see the periorbital puffiness or puffy face. This is periorbital or facial puffiness. Periorbital swelling or facial puffiness we can see. We also say this condition is nephritic faces. Nephritic faces. We will see the nephritic faces. We will see the nephritic faces, and as already discussed, there will be narrowing of the palpebral fissure. On examination, there will be narrowing of the palpebral fissure, and we can also see if there is a involvement of the skin, then we can see the lesions of scabies as we already discussed on the finger webs, on around the umbilicus, in the groin area, around the elbow, and below the nipple line we can see the lesion of scabies. And if the patient has sore throat, there may be enlargement of the tonsils, or there may be congestion of the pharynx. And on examination the BP will be on higher side because the kidneys are involved, the BP will be on the higher side. And since acute glomerulonephritis the kidney is involved, it is a hypervolumic state. Because of the hypervolumic state we can see the engorged jugular veins, engorged jugular veins, and there may be rise of JVP as well. And the patient may also have pallor because the kidneys are involved. Patient can have pallor also. And sometimes these patients can present with anasarca. So swelling all over the body. Anasarca is swelling whole of the body along with effusions in the serous cavity. So the patient can have anasarca as well. So the patient can have anasarca also. So this is brief about acute glomerulonephritis. So this will be the history. Though this is just a part 1 of the lecture, we will briefly discuss this acute glomerulonephritis. I will summarize it. So what is your diagnosis? The examiner will ask, and you will say it is a case of acute glomerulonephritis, which is probably due to streptococcal infection, and then the examiner will ask, why do you say it is a case of acute glomerulonephritis? You will then elaborate the history. You will say, one point I forget, you will say the onset of the disease is acute and progressive. So on the history, you will find a 12-year-old boy, young boy, presenting with swelling of the face, having scanty urine and having hematuria and smoky urine. And mother will elaborate the symptoms of his son, like he will say, as he gets up early in the morning, there is periorbital swelling. Then you will say then there will be history of itching prior to this involvement of the kidney, itching all over the body. Few weeks back, the patient will give the history like this. And on the examination, and then you have to take the negative history, like you will rule out there is no history of hepatitis B, no history of hepatitis C. You have to rule out chicken pox, measles, mumps, viral infection, history of drug intake like steroid, diabetes and hypertension. You have to rule out these conditions. Then on examination, you will find the periorbital or facial puffiness. You will see the narrowing of the palpebral fissure. You will see the lesions of scabies. You will see the tonsillitis, tonsil enlargement, pharynx congestion on the pharynx, and BP will be raised, and there will be engorged neck veins, and you can also find the anasarca. So what is the latent period? This is very important. What is the latent period? Latent period we have discussed is latent period for sore throat. After sore throat, the latent period is 1 to 3 weeks. After 1 to 3 weeks, the kidneys are involved, that is acute glomerulonephritis. So if skin is involved first by the bacteria, then after 2 to 6 weeks the kidneys get involved. So this is briefly about the acute glomerulonephritis. Hope you like it. This is part 1 of the lecture. If you like it, please do subscribe. Thank you. So that's it.